Welcome back to Stop Feeling Like Shit podcast. And I'm your host, Daniela Korth, with my favorite person, Dr. Buzz. And on today's
Mhm.
episode, we're going to be talking about chiropractic. And our special guest today is Dr. Eric Mack from Buckeye PMR and Anti Aging. Dr. Mack, hi.
Hi.
Tell us a little bit about yourself. How did you actually get into chiropractic?
Well, first, I want to say thank you for allowing me on this podcast. I really appreciate it. This is my first podcast, so I feel really
Do you feel
special
nervous?
right
Are you
now.
nervous? No, you don't look like it.
A little bit, but I got to stay cool. But
Okay.
as far as I'm concerned, my name is Dr. Eric Mack. I'm a chiropractor. I've been working for Buckeye Physical Medicine and Rehab since 2016. My backstory goes back to pretty much college is when I really started to dig into chiropractic. I'm very honest. Prior to that, didn't know much about it. Honestly, for me, we always slotted chiropractors as, oh, my back hurt, go to a chiropractor. That's the only knowledge I had about it. But when I went to Ohio University, I went as an exercise physiology major, and I was going to initially get into physical therapy. It was a gentleman by the name of Franz Hagerman who started the exercise physiology program at OU that took a liking to me. And he just was always giving me information, and he decided to say, "Hey, Doctor, well, I wasn't Doctor Mack at the time, but hey, Mac, you're I know you're looking into PT, but did you look into all your options with your degree?" And he gave me a pamphlet on, PT, physician assistants, MD, chiropractic, occupational therapists. He gave me about 6, 7 pamphlets and information on different professions. And as I started to research all of them, I just kind of, chiropractic just clicked. I kind of fell in love because my family, we was always kind of more on the natural side. Like, wasn't big on just pumping medicine and stuff like that. I'm the type of guy that I get sick, I would throw layers on, drink a bunch of tea, go vegan, and sweat a cold out.
Yeah.
Right. So I was doing that as a kid. So when it came down to the holistic model of chiropractic, it clicked. And then as I researched into it more, it just started vibing. So then I started reaching out to schools, applied for schools, got accepted into all the schools that I wanted to go to. Ended up going to Life University in Marietta, Georgia. Went down there for 3.5 years, got through the program, graduated, got licensed, and then started practicing.
Wow, that's great.
Yeah,
Yeah, and I think that's you don't really hear much about chiropractic. Like when I was in college,
absolutely.
you don't hear about it. No one's
Hmm.
offering
That's
those
true.
options to you.
That's true.
And also, when I have thought of a chiropractor before I met Buzz,
Hmm.
I was like, you're just adjusting backs and
Hmm.
cracking necks,
Hmm.
right?
Yep.
And there's so much more to it. Now, there are some clinics that only do adjustments,
Right.
right?
Right.
But then since I met Buzz, there's so much more to it, which
Yep.
is so awesome.
I
I
think
really love it.
I think one thing you have to realize that when you go to healthcare professions, you have medical doctors, DOs, physical therapists, physicians assistants, nurse practitioners, and then chiropractors. Chiropractors are the only physicians though that they look at things from a different viewpoint. So
Yep.
chiropractors, when you come to like a Buckeye,
Hmm.
if someone's not they have a problem, instead of thinking what can we do to mask it, as a chiropractor, we're trained how can we get the body to heal itself? And
Exactly.
it's the only healthcare profession that looks at things that way. So it's a
Exactly.
different spin. And my story is very similar.
Hmm.
I was going to school to be a medical doctor,
Hmm.
but it just didn't make sense to me. Like
Hmm.
it just like because I was always kind of thinking I was taking vitamins. I really didn't know what the hell I was doing, but
Right.
I would take a bunch of vitamins, and I was anti-medicine. And I met a chiropractor. It was the same thing. Like he taught me the viewpoint. We want to get the body to heal itself instead
Hmm.
of giving things to mask it. So I think we're drawn to that. So but don't think it's just chiropractic is not just back pain, because when
Right.
you go to most chiropractors, at least Buckeye, we can speak for.
Hmm.
No matter what your condition, if you have headaches, you have gut issues, shoulder pain. It's not just back. Any type of injury, we're going to look at you, and it's all about sequencing too. It's always
Yep.
the problem with modern medicine is really when you have a problem, they give you something to mask it
Hmm.
first.
Hmm.
So if you have shoulder pain, instead of saying, "Well, what's wrong with the shoulder?" let's give you some medication to
Help with the
mask the
pain.
pain.
Exactly.
And the analogy that would be similar to, if your check engine light comes on in your car,
Hmm.
you know, would you go to the mechanic that wants to figure out why the check engine light on, or would you go to the mechanic that puts duct tape over the check engine light?
Right. Right.
Mm-hmm.
And that's a huge difference, right? So that takes a little longer, though. I think an average
Very true.
chiropractic visit is a lot longer than an average medical visit. I think an
Very
average
true.
medical visit in the U.S. is 6 to 7 minutes.
Wow. I didn't know that.
Yeah. So
That's
yeah.
Yeah.
So an
that's a
average
crazy
first
number.
visit here is how long? How long?
I mean, you're probably 30, 45 minutes to an hour. I mean, because we're doing intake, we're doing a full workup on you as far as an examination. I mean, we're checking you from pretty much the orthopedic standpoint, whether it's through the testing to see what's going on physically. We're testing the nervous system as well. We're testing reflexes. We do diagnostic imaging at our office as well, whether it's x-rays and things of that nature. So it's a comprehensive exam. So we want to get as much data as possible on the patient so we can properly treat the patient. Because like you said, it's just not about chasing the symptoms, right?
Right.
One big thing about chiropractic, like you mentioned, Buzz, which kind of separates us again, is we deal in cause, right? We try to correct cause. We don't try to correct the symptom. Like you
Right.
said, we don't just go after the check engine light itself and put the duct tape on. No, what's causing the check engine light? Oh, that code. Okay, let's go fix it. If it's your O2 sensor that's off, okay, well then that's equivalent to maybe your L4 being out, right? So then therefore we need to figure out what's causing L4 to be out. Why is that happening? So that's why our exam is so comprehensive, so we can get all the data and start treating you from that standpoint.
And not everyone gets adjusted. Like I
Very
think
true.
there's another misconception too. You think, oh, the chiropractor's gonna crack my neck or crack my back. Like there's some conditions we treat here, like disc injuries,
Yep.
that when diagnosed, like you don't want to get those adjusted. That's when
Exactly.
you use decompression therapy, right?
Exactly.
So there's this. I think there's the general public has this picture of someone going there and they're getting you're
They're
wrestling
getting
them on
cracked,
the bed or
yeah.
something. Yeah, and that some patients need adjustments, but a lot of patients don't need adjustments. They need other things, and I think that's one thing that does separate Buckeye out. And the other thing we have here is we have a full-time medical doctor on staff here.
Yep.
So two heads are better than one. So I know then you'll sit down with Dr. Bainan, who's been here as long as you've been here, I think, and you'll give your chiropractic viewpoint. She'll give her medical viewpoint, and you guys kind of work through that together. And that team approach, I think, is really cool. And we even have a neurosurgeon we work with now, Dr. Shahadi.
Dr. Shahadi, absolutely.
He was the head of neurosurgery at Grant for years, and he even understands, like, we've educated him on what we're doing, and we co-treat with him. So if there's a case that could potentially surgical, we run it by him too. So that takes time.
It does. It does.
But it's a better, more comprehensive approach for
Absolutely.
sure.
And honestly, the patients that go through it and they see that we have that network, they appreciate it. I mean, they love the fact that we don't just approach it from the standpoint that most people are used to. A lot of times
Right.
with the way that Western medicine is and how we approach medicine is, is reactive is the word I like to use. I think a lot of times with chiropractic, we want to be more proactive. Now, of course, most people are coming in a reactive state because they may be coming because they have a condition. But through another thing that we didn't mention, a good thing about chiropractic is education. I think good doctors or good providers are really good at educating their patients. And I think what I've seen from definitely at Buckeye, our standpoint is the patient leaves smarter than when they came. So they're just not just coming to say, hey, okay, I got back pain. Can you fix it? No, we're going to help you with your issue, but I want you to understand the why, the what, and then when you leave, you're thinking like, okay, hey, I don't want this issue to happen again. Let me be proactive now. So
Right.
I always tell people when it comes to what we do, I liken our bodies to a car sometimes, right? So if you got, let's say that check engine light came on. Now you went to the mechanic, us, the chiropractor, with the mechanic. You come. We actually not going to put the duct tape over the check engine light. I'm going to check and find out what's the reason this check engine light is coming on. So then when we figure that out, we correct that issue. Now the check engine light is off. But I'm going to tell my patient after the check engine light is off, hey, we don't want that light to come back on. So you probably need to approach your health like this, and you probably need to be doing this, or you probably need to come on a maintenance proactive basis versus a reactive corrective basis.
Right.
Because
I
spinal
like that.
hygiene is kind of like dental hygiene.
Dental hygiene,
right?
exactly.
So a lot of people recommend come in once a month just to make sure your spine's, all the joints are moving properly, or if you have shoulder issues or whatever. Chiropractic is not just spines.
Exactly.
To make sure we're clear on that.
Exactly.
We do feet, we do knees.
I
we
mean, if
do
it has a joint,
shoulders, yeah.
if it has a joint, if any structure pretty much on
Jaw.
the body, we can do
Yeah.
it. We can do it. I mean, we get patients with all types of issues, whether it's TMJ, like you mentioned, whether it's a knee issue, ankle. It could be. I mean, I have a patient right now that's dealing with a big toe issue.
Oh, wow.
And they're like, they've been struggling with it for a long time, and now they've been coming to us. We've been doing some treatment with them, doing some laser with them, stuff like that, which is not necessarily
Helping the body
adjusting.
heal itself.
Exactly, we're helping the body heal itself.
Yeah.
And that's another thing I'm big on too, because like I said, I'm very big on education. I try to help the patient understand that, because I do get the people that come in and say, "Hey, doc, can you fix me?"
Right.
And I say, "Hey, okay, here's my spiel, and I'm not going to tell you I can fix you, but I'm going to put your body in a position where it can fix itself."
Oh, that's great. I like
So,
that.
that's
Yeah.
Yeah, and I mean, I would almost say, if you really think of it, most patients you probably don't even treat until you spend almost 45 minutes, because you come in
Yes.
for an intake,
Mhm.
and then you have a team meeting on it,
Yep.
and then you bring them back.
Yes.
Like, so
Yes.
compared to 6 minutes and here's some pills.
Right. Oh, pretty much. Most of the time you go into a doctor's office, you fill out your intake, you give it back to the front desk. They go back and send it back to the doctor, or they're going to come back and get you. They look over it for a quick minute. Oh, okay. Tell me what's going on. Okay, whoop de whoop. and you out of there, right? Like he said, you do your intake, that gets
Yep.
sent back. Once we get it, hey, let's sit down, let's collaborate. Me, Dr. Bainan. We have other chiropractors that work with us too, so I might meet with them because, like he said, multiple heads are better than one. I like to get multiple eyes on the data too, just to say, hey, you may look at it different than what I may look at it. You may catch something that I didn't catch.
Right.
So then when we do get them back, we didn't had a whole conversation about this patient. So now we have a better understanding on how to approach their examination and their treatment.
That's great.
And the same thing with the follow up, right? So once even, they rarely get treated on the first day. So when after the first day we do our workup, when I meet with Dr. Bainan and my other chiropractor again, and we look over the x-rays and look over the examination information, we come up with a comprehensive game plan for the patient. And then when we bring that patient in, we describe that game plan to them. And if it's to their liking, we move forward from there.
Wow.
Yeah, and I think it's about we go back to the sequencing thing. So if you have back pain and you go to a traditional medical doctor, 6 minutes, you have back pain, they're going to put you on pain medication,
Exactly.
which does nothing to fix it.
Yeah, it's a Band-Aid.
Yeah, so it's the the ducted or the check engine light. And if that doesn't work, then the next they probably take you for an epidural injection
or cortisone or something like that.
Yeah, which steroid injections once again do nothing to help it and only make it worse.
Exactly.
They're not even FDA approved. They're so dangerous. I don't know if you knew that.
No, I mean I knew that, but a lot of people don't know that.
Yeah, so epidural injections are not FDA approved for a reason because they're dangerous. And when that doesn't work, then it's surgery. That's like a typical medical and maybe physical therapy, but with a lot of injuries like a disc injury, physical therapy always makes it worse.
Yep, you're going to be compressing that disc.
Yeah, so where if you come to Buckeye, the flow would be, probably 30 to 45 minutes of whatever we do to figure out what the heck is going on. And then, doing something, to help the body heal itself, whether it's an adjustment, it's decompression therapy,
laser therapy,
exercise. There's a bunch of different things here to help improve it. And if for some reason that doesn't work, then you can do surgery.
Exactly.
But once you do surgery, the sequence is off. Surgery should always be last.
Yeah, I'm with you, Buzz. I always say this. One of the things I tell my patients, we get a lot of patients that come.
And I'm not anti-surgery.
No, me either. I mean, it's a place for it, but I think that once again, unfortunately, a lot of people look for the quick fix, right? And because of how we've typically learned about the medical field and medicine, most of us learned coming up. Okay, hey, you got a problem, go get either a drug, go see the doctor, or you're probably going to have to go have some type of surgical intervention. So that's most people have that thought process. So when I have my conversations with a lot of the patients, one of the big things I tell them, definitely because we get a lot of people that's coming to us saying, hey, the doc is telling me I need to have a fusion surgery, or I need to have a discectomy, or I need to have a, let's say a meniscectomy or something like that, or they need to have a knee replacement. And I always tell them, have you exhausted every option? Have you tried everything, right? Because surgery is the last thing. Once they cut on you, they can't uncut on you.
Right.
You get it? So I always tell people that and educate them on that because, a lot of people just want that, well, the surgery, I'm going to get the surgery, so it's going to fix me. And it's just like, well, it's not going to fix you because after surgery, you got to do some type of rehab anyways.
Right.
So is it really fixing the issue, or is that's just a replacement and now you got to figure out, you got to
rehab first, not to have the surgery.
Exactly.
And we treat a lot of people here too that suffer with FBBS, which is failed back surgery syndrome.
Yep.
50% of low back surgeries end up in failure. 50%.
That's a crazy stat.
Yeah. So so why would you do that first? And once again, I would even go so broad as to say anybody who ends up having surgery because of degenerative joint disease is because they didn't treat in time.
I agree.
Now, if you had a bad car accident, motorcycle accident, severe sports injury, sometimes those are straight surgery first.
Yeah, that's inevitable.
But if it's because of a degenerative condition, it's because you didn't come to a place like Buckeye and fix it before it got to that state.
Exactly.
So you had the cavity and chose not to fix it, so now you got to pull the tooth.
Exactly.
You know what I'm saying? So, but so anyone listening is if you and what you have to understand, if you have back pain or knee pain, shoulder pain, anything, and you don't do anything about it, it always gets worse with time.
I agree. That's your alarm system. I mean, if you're having pain, that's your alarm system. Your body is telling you something for a reason. A lot of us tend to want to be tough and push through. I mean, you've seen this.
You can't train through injuries.
You can't train through injuries, right? We
doesn't work that way.
We both play sports. We know how that goes, right? Yeah. So we see this all the time. And what ends up happening is when they do get to the point where they go see somebody, definitely if you're going to go see a orthopedic specialist, for example, right?
Orthopedic surgeon. So once again, we got to be careful. Surgeons do surgery.
They do surgery. Exactly. You was right where I was going.
So, and we work with surgeons. We have we actually have a neurosurgeons on our staff.
Right.
So we're not anti-surgery, but
and we work with plenty of orthos.
It's last.
Exactly.
You know what I'm saying? Now, if you totally tear your ACL, go have surgery.
You gotta go have surgery.
Totally tear your rotator cuff, go have surgery.
Gotta have surgery.
partial tear,
Yeah.
you don't need surgery.
Exactly.
We can rehab it here. We
Exactly.
can do, A2M, some
PRP, whatever it may
allograft
be.
stem cell stuff, PRP. There's options out there,
I
right?
agree. I agree.
So,
But it's just not enough of I don't think the information is being accepted by enough people.
Right.
Right? A lot of people aren't seeking it. Most people are just like, let me find the quickest route. And what
Well, a
my
lot of
insurance
people
gonna
want a
cover?
quick fix. They
Yep.
don't want to be in pain.
Agreed.
I have an opinion
They
on that.
also want insurance to pay for it.
Exactly.
So if they have to come out of pocket, they're like, I can't do that. Or like, how am I going to pay for this up front? So, and a lot of people, when you talk to them right now, even when we talk to people,
Mhm.
it's like, does insurance pay for that?
Mhm.
And then I have to explain to them, like,
All
insurance is
works
for
the same way.
catastrophic
All of it.
things,
Yeah,
right?
all insurance works the same way. You know,
Right.
we always talk about the analogy of car insurance. You know,
Right.
anyone has car insurance. Does your car insurance replace your tires when they're bald?
Nope.
Of course not,
Nope.
because that's not catastrophic in nature. Now, if you
Exactly.
crash your car, you submit a claim, because that's catastrophic. Your insurance covers it.
Mm-hmm.
The same thing with your health. It's not going to do anything to maintain your health.
Very true.
But when you have to replace the knee, have the back surgery,
They pay for that.
then they pay for that.
Yep.
But obviously, that's not the best route.
No.
You know, and the treatments here, we're not talking about a bunch of money. Most people have $1,000, $2,000 deductible. That's usually enough to fix anything that we need to fix.
Mm-hmm. Very true.
So everyone can afford the care, and we have finance patients. If we, and the other thing about Buck, I'll say is we only accept patients we know we can help.
Very true.
So there are some people. I mean, we can't help everybody. So if you come in here and we can't help you, we'll just tell you, hey, this has progressed too far. You're a surgical candidate, and we'll send you on your way.
Mm-hmm.
But if we say we can help you, we can help.
Yeah. I mean, and I know you've seen it, Buzz. I mean, the results we get with some of our care, I mean, that's why I love what I do, right? We actually get to see people get better.
Mm-hmm.
We visually see it. Whether it's through chiropractic care, whether it's through decompression, whether it's through laser therapy, whether it's through A2M injections, whether it's through allographic stem cell injections, we see these people that might have went from a standpoint of, oh, I was told I had to have surgery because I'm bone on bone.
You hear that every day.
You hear that every day, right? Because people go to surgeons, and what surgeons do. That's how they butter their bread. And then they come to us, and now they're like, Doc, I feel good. I don't have to get on that surgery table now. I'm not having that issue anymore, or my pain levels are so far decreased. I'm back doing stuff functionally that I wasn't able to do a year ago after coming to you all. So like that's where the reward in what we do is awesome.
Yeah, that's great.
Yeah.
Wow. Wow, we talked about a lot there
Mm-hmm.
just in that little segment. And I also wanted to bring up something else too, where I don't want people, so we talk about chiropractic
Mhm.
and we talk about the spine,
Mhm.
right? And so also let's talk about like the nerves
Sure.
and the muscles, right? So people that have like some pinched nerve issues in the neck and all that stuff.
Right.
So,
Often misdiagnosed.
Yes.
yeah.
Often
So-
misdiagnosed.
So much so.
Have
So
a
yeah,
good-
so tell us where the nerves are located and
Well, if we do a breakdown of the nervous system, so you'll start with the brain, right? So your brain is your control center. It controls everything as far as your nervous system is concerned. So extension of your brain is your brainstem, and then from your brainstem you go to your spinal cord or spinal column, right? After your spinal cord, spinal column, there's nerve roots that come out of those. There's nerve roots that send out nerves to every part of your body. There's not
Mhm.
a part of your body that isn't innervated or being controlled by something neurological or from a nervous system. So those nerve roots go everywhere. So pretty much what happens with a chiropractor, where we come in at on that standpoint is your majority of your nervous system is through your spine,
Mhm.
right? So reason we get slotted as, we just crack backs and crack necks is because really our goal is to take pressure off of your nervous system. We need your nervous system flowing as close to 100% as possible. The way I liken it is like a water hose, right? You think of a water hose, if you turn on the water hose and it's unkinked, the flow is perfect. It's 100%. The water is it's coming out exactly like it needs to. But if you step on that hose or if there's a kink in the hose, then the water's still going to come out, but it's probably only going to come out at 85%, right?
So even the weight of a quarter on one of those nerve roots coming out decreases function of the nerve by up to 70%.
So think about that.
Wow.
That is extreme. So if you're only getting 30% nerve flow to an area, then you're not maximizing that area. Then that area is not doing everything it needs to do because your nervous system controls everything.
Right.
So when we're talking about our muscles as well, nerves innervate every muscle in the body. So if the nervous system isn't operating properly, then you're going to have an issue from a muscular standpoint as well. And a lot of times with pain, our pain generators are our muscles. So a lot of people feel it in their muscles, but a lot of times it's secondary unless it's a direct trauma to a muscle, it's typically secondary to something else going on that may be causing a disruption in your nervous system.
I had a good friend of mine's an OBGYN, And she called me a few weeks ago, and she's like, I think I pulled a muscle in my butt, you know, and it won't go away. What can I do? Whatever. And I was like, well, when's it hurt? Well, it hurts when I first wake up in the morning, and it hurts when I sit. So let me get this straight. So your muscle hurts worse when you're relaxing than when you're moving.
Thank you. Right.
So that right there tells you it's not the muscle.
It's not the muscle. Exactly.
So I said, it's probably your back. Well, she's like, well, my back doesn't hurt. And I said, yeah, but a lot of people that have spinal problems have no back pain whatsoever. Like I had a disc in my neck. My neck was great.
Right.
But I had pain in my shoulder.
Exactly. Or you get headaches or something of that nature. Right.
So, but then you go to a regular doctor, the 6-minute visit. Oh, you have some pain. Here's some anti-inflammatory medication, which does nothing to fix it. And then, it progressively, remember, if you don't do anything about an injury, it always gets worse with time.
Exactly.
And then they wait, and then the disc ruptures, and they have to have neck surgery or back surgery. That's exactly what happens.
All the time. We see that a lot.
Wow.
With people. Because that's just how people are. Definitely, unfortunately, in today's time, people always feel like they want to push through. So a lot of times, a lot of people aren't going to the doctor until it's like excruciating. Right. It's like it's shutting them down or it's stopping them from doing their day to day. And I think that's where, one thing I'm big on is, like I said, with education, is I want to get people out of that mindset. Like, listen, go be proactive about your health. Don't wait till it's a huge issue. Like he said, she's, been dealing with that issue in her butt for so long. And she's like, oh, it's when I sit and when I do this.
She's a doctor.
And she,
a very high level doctor.
Doctors are the worst. We the worst patients a lot of times. But people just wait to the very last minute. And that's when that's when you're making it harder for you to heal because it doesn't get better. It gets worse over time.
Right. Because we always think, and this just isn't just with like back pain. It's
just in life.
Anything.
Any pain.
Any pain. If you don't feel well,
that's very true.
At all, will maybe I'll feel better tomorrow.
Exactly.
Or you know what? And then I'll do this to myself too. It's like maybe I just need to work out again, or maybe I need to just go to the sauna, or maybe I should go for a walk again. Maybe I should do this. And that's what people do. They're like, well, maybe I'll push through it. And that's what they do. And then here you are 2 years later. And you're like, guess what?
Yeah. Exactly.
Now we have a whole slew of things to fix. And it's going to take 4 years. Or,
exactly.
It's going to take a long time. And a lot of people, and myself included, I'm a very impatient person. I want results right now. If I don't see them, I start to get frustrated. But then I also have to remember, I spent 12 or 13 years doing this to myself, destroying myself. And when you sit down and you really think about it, you're like, you know what? Now I understand. I did this for so many years this way. I never did anything else to change it. I never asked any questions. And now I'm trying to fix it. And it's not going to happen overnight.
Right. That's very true.
Yeah. So, wow.
So if you ask who should go to Buckeye or who should come here, I said pretty much if you've had pain somewhere for more than 2 weeks, it's probably not going to get better on its own. Now, if you stub your toe today, you don't have to come to Buckeye.
I agree.
Right.
I agree.
You know what I'm saying? If you tweak a little something. But if you've had pain for a couple weeks, it's a problem. Okay. And what people don't, if you want to take it down to the molecular level, when you have pain, what happens is your body releases these proteins called cytokines. So the reason your body releases these cytokines is because you've injured something, and it's a warning. Hey, don't, if you have a pain in your knee, hey, don't go running on the knee. We'll release those cytokines. But the other thing that happens is when the pain's there for a longer period of time, your body also releases these other proteins called proteases. And the reason the body releases proteases, they're like little Pac-Man to clean up damage. So if you've had pain somewhere for a long time, the body thinks there's damage there. We need to clean it up, and it releases those proteases. But the problem with the proteases is they lead to arthritis.
Precursors,
So if you have chronic pain, 2, 3, 4 weeks, a year, and you don't do anything about it, that joint is degrading because the proteases are eating the joint away. They're eating the ligaments, they're eating the tendons, they're eating the muscles, and eventually you're going to tear something or need surgery.
Exactly.
So that's what the path of chronic pain.
And I can attest to that. I mean, I use myself as an example of that. I tore my Achilles in 2020. Former football player, but played sports since I was 3, 4 years old, and came up at a time where I had plenty of aches and pains. I mean, sprained my ankles dozens of times. My ankle always gave me trouble, and at the 2020, 35 years old, never had a major injury prior to that. Doing something as simple as playing basketball with my oldest son, to rupture my Achilles.
You had low level pain there ahead of time.
Yeah, so because my ankle had always it was unstable. Like I had sprained it so many times, and from basketball and football, but it was one of those things where how we came up. Oh, ankle sprain. Oh, that's nothing. I just turned it, and I kept doing that to my ankle. To eventually, my ankle said, "Okay,
We're done.
Well,
We're
the
done.
proteases were eating
And
that
they was
ankle
eating
the
that
whole
ankle
time.
away the
and
whole
then-
time. I mean, and when they did the MRI after I tore my Achilles, it showed that I had multiple tears in my calcaneofibular ligament as well, my spring ligament. So it's like they had been torn for a while. It was like to the point where the doctor even said, he's like, man, it's one of the worst ankles I've seen in a long time.
Mm.
Wow.
But I didn't know that until I actually tore the Achilles, had to have the MRI, and it was because I wasn't proactive. I
right.
didn't do what I needed to do with my ankle. I would do little stuff here and there, but it was really when I felt like it was really bothering me. So I had to learn the hard way myself.
Sometimes
Right.
you gotta learn the hard way.
You gotta learn the hard way.
Yeah.
Exactly. Yeah, even
That's
as a
what I
provider.
tell my kids at least, right?
Oh man, I'm with you
Yeah.
on that.
Yeah. Wow. Yeah, and I always think that once we learn the hard way, then that's the best education you give someone.
Unfortunately, right?
Yeah,
Unfortunately,
so-
we should want to be take heed to those ahead of us or before us that went through those. But unfortunately, some people need to fall on their own.
Yeah, this is true. All right, awesome. Wow, what a great episode. Do you have anything else to share?
No, I just thank you. I really appreciate it. Like I was telling her, this is my first podcast, so like this is awesome. I appreciate y'all having me. I watched all the podcasts, so this
You
is
do?
definitely
Aw,
this is
great.
a blessing. I love being here. I love this talk, and I would love to be back.
Well,
Yeah, well-
guess what? You're in luck. Don't go nowhere because
Awesome.
you are on the next episode. And if any of our viewers out there, if you have a spine issue, if you have something going on, you have pain, anything like Dr. Buzz said and Dr. Mack said, you can come visit Buckeye PMR. And even if you have a question, we can help you. Just drop us a DM. And so stay tuned because Dr. Mack is coming back.